Hello, this is Cognitive Behavioral Therapy Group 1, The Relationship Between Thoughts, Feelings, and Behaviors by Haley Irwin, Zena Jones, Tracy Fisher, and Cherie Kohler. Cognitive behavioral therapy defined is psychotherapy that combines cognitive therapy with behavioral therapy by identifying faulty or maladaptive patterns of thinking, emotional response, or behavior, and then substituting them with desirable patterns of thinking, emotional response, and behavior. Albert Ellis developed rational emotive behavioral therapy in the 1950s. He used a framework that he called ABC, A being the initial event, B being a person's belief or perceptions about what happened, and C the emotional and behavioral response. He felt that irrational thoughts or beliefs led to dysfunctional emotional responses and potentially problem behaviors. He also believed that self-talk, which is what we say to ourselves and how it affects our emotions and behaviors, can be used to change negative thoughts into positive thoughts. Aaron T. Beck combined behavioral and cognitive theories to create cognitive behavioral interventions. His idea was very similar to Albert Ellis's in that it had 3 steps. First, you identify the irrational or unhelpful thoughts. Second, you alter the irrational or unhelpful thoughts. And third, you foster emotional and behavioral change. He created a structured and short-term and present-oriented psychotherapy to be used for depression, and treatment is also based on the understanding of individual clients and their personal beliefs and behaviors. This is a model of cognitive behavioral therapy. First, you have your situation, which is something that happens to you. Second, you have your thought process and how you interpret it. Third, you have a feeling that occurs that changes your emotion. And fourth, you have a behavior or an action in response. Cognitive distortions are ways that our mind convinces us of something that is not really true. These inaccurate thoughts are usually used to reinforce negative thinking emotions, telling ourselves things that sound rational and accurate, but really only serve to keep us feeling bad about ourselves. The principles of theory for cognitive behavioral therapy is based on ever-evolving formulation of a patient's problems and an individual conceptualization of each client in cognitive terms. It requires sound therapeutic alliance. It emphasizes collaboration and active participation. It's goal-oriented and problem-focused, and it initially emphasizes the present. Principles of theory continued. Cognitive behavioral therapy aims to teach the patient to be their own therapist and emphasizes relapse prevention. It's time-limited. Sessions are structured. It teaches clients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs, and it uses a variety of techniques to change thinking, mood, and behavior.
CBT is used to treat a wide array of conditions, including anxiety, eating disorders, bipolar personality disorder, and even substance abuse. CBT is also exceedingly effective in treating PTSD. PTSD is when a person experiences a traumatic event or has a strong negative emotion regarding that experience. PTSD can occur in anybody: military, rape victims, victims of violent crime, and even professionals who are working with these victims. CBT teaches the client to identify their inaccurate thoughts and to take those beliefs and change them to a more beneficial and positive belief. Treating PTSD is exceedingly important in the United States. There is about a lifetime prevalence of 8%. PTSD lasts for over a year in 50% of cases. The symptoms are severe, which include nightmares, flashbacks. People avoid thinking about the traumatic event. They have outbursts of anger, and they have restricted range of affect. So they're unable to express themselves. Imagine living your life having extreme fear to random stimuli. That's what the clients who are suffering from PTSD are living through. CBT helps the clients desensitize themselves to the trauma. It teaches the client to recognize the connection between thoughts, behaviors, and feelings. Sometimes clinicians use worksheets, other times they just have the client use a journal. As a clinician, you have multiple options of therapy to use, all which include some sort of CPT. Many clinicians use cognitive processing therapy, which includes many elements of CPT, to address the symptoms of PTSD. In order to use cognitive processing therapy, clients are asked to write about their worst traumatic experience and how it affects them. They focus on self blame and how it affects their view of themselves and other people. While therapists are working with these clients, they challenge them to question their own thoughts. This is the core belief of CBT and how it works. CBT also has long term effects of treatment success rates.
Hi, my name is Zina Cabrera, and today I'm going to be discussing the strengths of cognitive behavioral therapy. So, cognitive behavioral therapy, CPT, has a unique set of strengths. CPT helps individuals cope with their symptoms by changing their negative patterns into positives. Our thoughts concerning a problem affect how we feel and act. For example, we've all been in Walmart where their lines are extremely long. I know for me, when my thoughts concerning a problem is this line is so long, it's going to take forever. I then begin to feel stressed. I start to feel rushed. I get anxiety. So, ways that I like to cope with it is, checking something on my phone, talking to a customer either in front or behind me, or either coming to Walmart a little earlier because I know that the lines are going to be long. That way I won't feel stressed. CBT strengths. CBT is recommended for certain populations such as youth and older adults. Youth can benefit more from CBT because their cognitive development is more mature. Because their cognitive development is more mature, they're able to have a better understanding and recognize their dysfunctional automatic thoughts. Whereas for older adults, they can benefit from CBT with modifications that target their physical and spiritual health by improving their quality of life. For example, an older woman who recently retired, she might feel lonely. She might feel, a sense of worthlessness. She has nothing to do. So a changed behavior that will get her moving and doing something to do, very active, would be planting. So planting will take a form of new change behavior and having her to have more fulfillment in life. CBT strengths. CBT have been proven to be effective therapy towards individuals who suffer from depression, anxiety, anger, eating disorders, alcohol, drug use, stress, and low self-esteem. This form of talk therapy allows an individual and a practitioner to discuss what's at hand and to break down the matter of their issues and find coping mechanisms to get them feeling away from depression, away from anxiety, anger, eating disorders, alcohol use, drug use, stress, low self-esteem, and finding more positive, changing their thinking patterns from negative to a positive.
As we learned in the previous slides, cognitive behavioral therapy can be an awesome form to use with some clients. However, it is important to note that it does come with its own unique set of challenges and limitations. Though it works well for some, it's important to remember it is not a cure-all or an appropriate form of therapy for all individuals. These next few slides are going to discuss some of the general limitations of CBT and who it does not work well for. CBT is not recommended for certain populations, such as those with intellectual disabilities or learning difficulties, and that's because they may not have the processing, rationalization, or communication skills necessary for this to be a successful form of therapy. It's also not recommended for those with schizophrenia or other diagnosed personality disorders. They benefit from pharmaceuticals, which can really help get their symptoms under control. CBT may be successful, but it cannot be a standalone for individuals like this. It's also not recommended for those with little capacity to reason logically, such as extremely young children or extremely old adults. There are 5 things a social worker should consider first before choosing CBT. The first is the client's motivation to change. If you have somebody who comes into their initial meeting and says, I don't really think anything is wrong, but my significant other makes me go to these appointments, CBT isn't going to be a solid choice, and that's because it requires the client to have their own motivation to change. The next is the time commitment. CBT can be a lengthy process. It requires the individual to come into meetings as well as do work outside of those meetings. If they flake out on appointments and aren't willing to do what is required outside of them, CBT isn't going to be successful. The next is the client's life stressors. If they have major life stressors that are hindering their daily life, it's better for them to get those under control first, and then CBT can be revisited after. The last 2 things I already discussed, which include the cognitive functioning and educational level of the client, as well as the severity of the psychopathology. CBT can be successful for those who have mental illnesses if they use a pharmaceutical alongside those to manage their symptoms.